Hi everyone. In the next video on my series on how to manage chronic pain, I'm going to be talking about the role of physiotherapy, physical therapy in managing that pain. Now in previous videos we've talked about the pain cycle and how prolonged pain experience, so chronic pain, can lead to people giving up certain activities or not conducting activities as frequently as they did before. And this then has the unintended side effect for them of actually increasing the pain they experience when they do undertake those activities. So to give people an analogy, you're advised to stretch after you've done physical exercise, so gym work for example. If you don't stretch, what happens is the muscles shorten as they rest, and that means that they cause a considerable amount of pain when you start to use them again. It's the same theory behind physical therapy for chronic pain. If you become less and less active, the times you have to become active will become more painful. So with regards to NHS treatment, most people who experience chronic pain, particularly chronic pain with a physical cause, so for example they might have back pain or pain from their legs or arms, will be sent to physiotherapists who will then advise them on how best to conduct activities, as well as giving them exercises to do and helping them do exercises that will free up those areas of the body, which means that when you do have to do your daily living tasks that you can't avoid, it's going to be less painful for you than it was before you started the physiotherapy. Now, one big advantage of the physiotherapy is that there are no drugs involved. Now, because there are no drugs involved, this is something that you can do over and over and over again to make your body as pain-free as it possibly can be from doing certain activities. One of the downsides of physical therapy is that if you have a condition where physical activity aggravates your pain, or you have a condition like mine where physical activity causes dislocations which cause pain, then doing lots of physical therapy and doing lots of exercises and doing as much activity as you can do is going to aggravate the pain, at times make it worse, and then risk pushing you back into the original pain cycle, as we've talked about, in terms of it hurts, therefore I don't want to do X, Y, Z, and then because you're not doing X, Y, and Z, when you do eventually have to do X, Y, and Z, the pain ratchets up. So for people like myself, it is a real balance between doing physical activity, doing physiotherapy, exercises and tasks, and also at the same time not aggravating your condition in a way that then puts you back into the pain cycle. Now, it's worth noting that doing physiotherapy exercises can be done obviously in combination with some of the things I've talked about on this channel previously. So I've talked about heat and heating and cooling. So if, for example, you have pain that's aggravated by physical activity and you're doing your exercises to try and reduce that aggravation or get rid of it entirely, why not then look at, well, if I use cooling packs at the same time, that's going to make the exercises less painful, or heating packs, these kind of things. We've also talked about pacing, so it's about how you pace yourself when you do the tasks. Obviously, there's only so far you would ever be advised to push the physical therapy, as in the number of times you do the exercises every day. If you do far too many of the exercises every day, then even if the exercises are causing benefit, all it's going to do is cause pain, because there's a limit to what benefit you can practically achieve using the physical therapy. So you've got to pace yourself. You've got to look at whether cooling or heating items are going to make the physical therapy exercises less painful and make the recovery better. You need to look at bits we haven't talked about yet. Diet. So for example, if you're going to be doing more exercise than you've done for a long period of time, then your body is likely to need more protein, because obviously exercise does cause a certain amount of wear and tear on the muscle groups and the ligaments and the tendons, and you're going to need to repair that. So protein is going to be very important to that. And as part of the pacing, you need to consider rest as well. So obviously there is a fine line with the bearing in mind the pain cycle. I keep talking about there is a fine line between resting and resting too much. What you don't want to do is resting to become a prolonged period of rest that means that you basically don't end up doing the activities, don't end up doing the exercises, and then you fall back into the original pain cycle. But at the same time, if you continue to push the exercises hard day after day after day, then all that you're going to be left with is increasingly sore and tender muscle groups, ligaments, tendons, and areas of your body, and that is then going to risk putting you back into the initial pain cycle. So physical therapy certainly has a place, as we've discussed. Because there's no medication involved in physiotherapy, it makes it not damaging, or there's no risk of damage in the same way that there is from medications. Obviously, as you build up the muscles and build up the functions that you're working on with physical therapy, you may need to look at increasing the difficulty of the exercises or increasing the resistance or things like that. But first and foremost, the key is to really focus on the physical therapy activities that are going to benefit your day-to-day life, because even if you pace yourself and you're very considerate about the tasks you take on a day-to-day basis, there are still going to be certain activities that, regardless of your condition and regardless of your chronic pain, you are going to have to do. So a prime example is going to the bathroom. It's the vast majority of us need to go to the bathroom using a toilet. There are obviously some people with other arrangements, catheterizations, colostomy bags, things of that nature, and they will obviously have their own processes. For the majority of us, myself included, we use the toilet. Now obviously you've got to get down onto the toilet, get up off of the toilet, these kind of things, and there are some movements in there that for certain types of chronic pain, certain locations or localities of chronic pain on the body, those movements have the potential to aggravate it. So you really do need to look at which physical therapy exercises are going to impact my daily life the most in a positive way, because if there are some tasks that you cannot really change how you approach them or change how you do them, then what you need to do is try and make sure they cause the least amount of possible pain during the process. So it's something that I would definitely recommend that anyone who's going through chronic pain and going through the early sort of diagnostic and identification phase with their medical professionals, it's definitely worth speaking to them about physical therapy, because it's incredibly unlikely that any doctor you're working with is going to say, no, I don't recommend physical therapy, unless your specific condition means that exercise and things like that is going to cause extreme aggravation or make your condition significantly worse. So it's something that is going to be widely available to the vast majority of chronic pain sufferers. It's going to be something that can limit the impact your disability has on you, and overall can reduce the pain you're experiencing on a daily basis. And after all, that's what this series is about, finding ways for you to reduce the pain you're living with to make your life better. So thanks very much for your time today. Obviously, if you have any questions about how physical therapy can help you, please feel free to drop me a message in the comments. Like and subscribe for further comments and discussions and videos on chronic pain and ways to manage it. We're obviously going to continue looking at this for the foreseeable future, and in the next videos we're going to be talking about medication as well as the psychological management of chronic pain, hobbies and other activities that you can look at as distraction techniques. So I hope you all have a wonderful day. I hope that this video helps you manage your chronic pain just that little bit better, and I hope to see you all soon. Thanks.